Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
10 out of 100 Ugandans are living with the hepatitis B infection. There is regional variation within the country. However, the highest prevalence is in the northern part of the country, ranging from 19% in the northwest to 25% in the northeast. Kenneth Kabagambe and Emmanuel Lutamaguzi have for more than a decade been living with hepatitis B. The two have since used the rather unfortunate life illness to create awareness around the country. According to the two, their advocacy has not been in vain.
We started this way back in 2012. But during the time we are starting the advocacy, there were completely nothing at the Ministry of Health, say in terms of personnel, even in terms of setting up a secretariat which is responsible for handling hepatitis programs. But now I can pride ourselves as an organization that we actually have a dedicated office at the Ministry of Health, which is handling hepatitis program. But also the awareness has quite improved.
We have been able to get hepatitis services for free, testing services and screening services. We have been able to get free vaccination services in all government facilities countrywide and in a phased manner. We have been able to get treatment services for free in all government hospitals.
Government has been able to allocate some resources, which was not there previously. So each financial year, government allocates 10 billion shillings towards hepatitis programs. So, and this is the money that the Ministry of Health is using to actually do mass testing and vaccination.
However, years on, they feel there are some challenges that have been recurring, including a low completion rate of the 3-jab hepatitis B vaccination in the country.
Issues with the follow-up in terms of the payments and the costs of the services. The government has been able to give some of these services for free, but then we still have a problem that most of them are at a cost and not every patient can actually meet this cost. For example, the liver function tests, the CBC tests, and then also getting the medications. To some people it is very difficult.
We do not see a clear framework that caters for the hepatitis B patients who are eligible for treatment. For instance, those people actually need to be put on treatment for the rest of their lives. And there is a drug called tenofovir. This tenofovir previously the government was providing, but at some time in 2019 it was withdrawn from the health facilities that are treating the hepatitis B patients. They are just struggling on their own. Either they are having it privately or they are using the regimen from the HIV drugs.
Not aware about that, because what I know is the medicine used is tenofovir, and it is we have capability to manufacture tenofovir in the country.
Majority of the people who receive their first dose for hepatitis B in the entire country actually never come back, either for the second or the third.
They forget because it's a reflection of their health-seeking behavior. Responsibility for our health requires behavior change of attitude, more seriousness. So for our population, at times they start, then they leave.
What is the danger?
There will be no danger. The danger is you are not fully vaccinated. Yeah, that's the only danger. You are not fully vaccinated. So the benefit which was supposed to accrue from undertaking a full vaccination, you will not get it complete.
Hepatitis B is a viral infection of the liver that can cause acute and chronic disease. Worldwide, about 2 billion people have been exposed to hepatitis B, and about 257 million people are living with hepatitis B infection. Dr. Jamada Lutakome, a medical officer with the Uganda National Health Laboratory Services, says hepatitis B is spread when blood, semen, or other body fluids from a person infected with the virus enters the body of someone who is not infected.
Amongst its mode of transmission, we have mother-to-child transmission, which the Hepatitis Aid organization is fighting so hard to stop. And it is the commonest, amongst the commonest, we have hepatitis B and C. Hepatitis B is incurable. Yes, if it is in the chronic stages, you have to be on medication. If you're supposed to be initiated on medication, it is lifelong medication. If you're not supposed to be on medication, it is the body that will suppress this, but you live with it. Yeah, but hepatitis C is curable. There is what we call a hepatitis B birth dose, and we are now currently advocating for it so that its intensity or it being administered in Uganda is increased. It prevents so much. This is only given to a child that is born to a hepatitis positive mother.
Dr. Lutakome says not all people newly infected with the virus have symptoms, but for those that do, symptoms can include fatigue, poor appetite, stomach pain, nausea, and jaundice.
This is only when you've taken a lot of time with it and you've not managed it clearly or well.
There is no specific treatment for acute hepatitis B. Therefore, care is aimed at maintaining comfort and adequate nutritional balance, including replacement of fluids lost from vomiting and diarrhea.
You're not supposed to take alcohol because it damages the liver. You're not supposed to take a lot of fats because it will lead to a fatty liver. You're not supposed to take a lot of oils. You're supposed to take green leafy vegetables. You're supposed to take a lot of water to help dilute the concentration of whatever toxins are in your body so that you ease the work of the liver.
Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.